I'm Ellen Whitus. I'm an advisor to the UC Merced Center for Community and Labor, and have spent a career trying to protect farm workers as an academic, as a regulator, as a policy advocate. And it's my pleasure to moderate this very promising and exciting researchers. We have an all-student panel with very interesting research that covers a multi-ethnic population. We have among them Hmong, Latinx, and Punjabi workers and farmers covered. Again, as we're reminded, I've asked the panelists to speak for 10 minutes to allow for about 15 minutes of Q&A after. As you do for the audience, any questions, please indicate a particular speaker if if you want further clarification or further development. So I'm excited to present our first panelist, Taylor Arnold, who is a PhD student at UNC Greensboro and also project manager for the Wake Forest School of Medicine. His paper is Structural Vulnerability and Occupational Illness among Latinx child farm workers in North Carolina. Taylor.
All right, thank you. Okay, so thank you again, and thanks to the organizers for letting me join this, even though I'm on the East Coast. I think a lot of the situations are similar, and a lot of situations for farm workers are quite different. But the co-authors for this paper are Tom Arcuri, Sarah Quant, Dana Mora, and Stephanie Daniel. So really, I have two objectives for this presentation. The first is to really present the broad experience of personal workplace injuries as described by the child farm workers themselves. And the second is to really highlight just a few of the structural factors that increase farm workers' vulnerability to injury and also sort of normalize bodily harm. So the background, which I think this audience is well aware of, is that agriculture is a hazardous industry, right? That's sort of why we're here today. And children as young as 10 can be legally hired as farm labor due to the Fair Labor Standards Act of 1938, which has this exclusion for children to work. So the data are very bad, estimates are unreliable, but anywhere between 30 and 80,000 hired child farm workers each year participate in farm work between 2005 and 2016, and this is each year. And the majority of hired children are children of Latinx immigrants or immigrants themselves. The way I approach these, the context of these experiences is through the lens of structural vulnerability, which is really a reconceptualization of structural violence that posits that structural vulnerability is really a particular positionality that creates vulnerability to forms of violence, racialization, exploitation, and subjectivity formation. And importantly, this vulnerability is distributed in patterned ways based on broader social relations of power and privilege. And this really necessitates that we can't look at the micro level of injury experiences without simultaneously looking at the macro level historical structural forces that create, maintain, and also hide these experiences. And then Seth Holmes recently introduced this idea of chronic temporality of farm worker injury, drawing from Lauren Berlant's theory of slow death. And really, this is sort of drawing some questions about some of the quantitative approaches to injuries through traditional epidemiological methods. Because particularly with farm workers, while there are acute injury experiences, there's long-term exposures over time that are sort of gradually deteriorate health. And this is all occurring again in the context of structural vulnerability. And then finally, in our previous analyses in North Carolina, the work context and organization of work in North Carolina really creates a dangerous work environment for children with high demands, little control, piecemeal support. And in many cases, the safety training, if they receive any at all, is limited, informal. And I think we see some of this in some of these narratives. So this is just a small part of a broader study that's a community-based participatory research study where we work with youth from farm worker families from the Levante Leadership Institute, and they've been involved throughout this whole 5-year study. This was actually the first part of the study where we did 30 in-depth interviews with children who were aged 10 to 17, self-identified as Latino or Hispanic. They were fluent in English or Spanish and had done farm work in the previous 12 months. And then we did a qualitative analysis using the transcripts from these interviews. A few brief points about the participants. So we had a few more boys than girls that we interviewed, but it was relatively split between seasonal workers who live in North Carolina year round and work during the season, and also migrant workers who generally here they come from Florida up through Georgia and then end up in North Carolina and then go back to a sort of a home base. And the recent crops that they had worked in were tobacco, tomatoes, and blueberries, but really they reported experience with a wide range of crops throughout their farm work experience. So now I'll just shift to a few of these examples. There were many more than this, obviously, but the time constraints, I'm just going to focus on a couple. So as far as musculoskeletal injuries, many children reported musculoskeletal injuries. This 17-year-old girl working in sweet potatoes said that you can't even sit down after work. And I said, why is that? And she said, because when you're pulling the sweet potatoes, you got to be squat down really low. You got to be picking them up. You got to be there 24/7 until they say break time, 12 o'clock. And that's pretty much a lot of time to be squat down. So it hurts. There were also several examples of more traumatic injuries. These included things from like cuts or blisters to also this example of a very severe injury, a head trauma injury. And so this 15-year-old migrant boy was hammering stakes for tomatoes, and it was his first time hammering very fast. The stake broke and hit him in the head. And then he said for the care, the contractor put something on his head, but he did not remember. We also found lots of cases of environmental exposures that cause some sort of illness. So in this case, it's heat-related illness, which some of the earlier panelists have talked about. And this heat was really the main negative aspect that the children reported about farm work. And so in this case, this 17-year-old boy said that he got so dizzy that he couldn't go back to work. He just stopped for the rest of the day. And he had forgotten to wear a hat that day. So the heat got badly to him. And then also green tobacco sickness. So in North Carolina, one of the major crops is tobacco, which is also one of the more hazardous crops because you can absorb nicotine through your skin as you're in contact with tobacco leaves. And this can result in acute nicotine poisoning, which is also known as green tobacco sickness. So I won't read this whole quote, but this 16-year-old girl who worked seasonally in tobacco just explained the symptoms of this, of throwing up multiple times, getting sort of different treatments from her godmother, but just continuing to throw up because she had acute nicotine poisoning. So these are a few of these examples of sort of these pretty severe injuries that these children are facing while they work in agriculture. So overall, the children tended to take a more reactive approach to injury prevention, which is sort of characteristic of their inexperience, but also the lack of protections, the lack of personal protective equipment. So if someone got blisters, or as we saw in the example, he forgot to wear his hat, after they got blisters, they might put on gloves if they were available again, and that's a huge question mark. They also talked about getting used to the pain or the chemicals or the heat, sort of as, and this sort of just demonstrates this normalization that this was just part of the job, and it was to be expected. And so really, when we look at structural vulnerability in these injury experiences, the precarity of farm work itself is really built into these laws, the Fair Labor Standards Act of 1938. And there's really a long history of worker disenfranchisement in agriculture that really dates back to the foundations of our agricultural system in the US, founded upon slavery. And then over time, powerful interests have reorganized and reinvented the agricultural system to maintain and ensure a steady flow of disenfranchised workers, which include children. I'm getting a chat, which is probably a time thing. Okay, thank you. I will wrap it up. Immigration, lots of undocumented or mixed status families. This creates further vulnerability because it limits their other options, limits access to healthcare, makes workers less likely to speak out against unsafe conditions. And then finally, official accounts of child labor around the globe by the Bureau of International Labor Affairs actually excludes the US from these analyses. So you can see children working in blueberries in Argentina, but no information about the US, even though they're working in the exact same crops. So to conclude very briefly, again, qualitative approaches do tend to give us some more information about the actual context in which these injuries are occurring, and addressing US agricultural child labor should really, I mean, it sort of seems like common sense, but revisiting the existing legal frameworks that allow child labor in one of the most hazardous industries, and also focusing on the broader structural context, such as immigration and labor laws, increasing wages, and including the affected communities in policymaking, and finally, improving injury surveillance systems and really focusing some of our research on mixed methods, longitudinal designs, so we can actually get a better sense of the extent of this issue. Finally, we'd like to thank all of the people who helped with this, especially the youth in the Levante Leadership Institute. And I'm just going to leave you with this, which was created by those youth in the Levante Leadership Institute on a different aspect of the study. I'll link to this in the chat. Thank you for your time.
Thanks so much, Taylor. Our next panelist is Chia Thao. Chia is a PhD candidate at UC Merced Public Health Department, and her presentation is Hmong Farmers' Pesticide Narratives. Chia.
Okay, thank you. I'm gonna share my screen. And let me just go on to the slide. Okay. Thank you so much for joining us for today's presentations. I'm excited to be part of such amazing teams, and thank you to UC Merced for hosting this conference. I think it is much needed during this pandemic. My research focused on Hmong farmers, specifically here in Fresno, and I entitled this part of my research, the Hmong Farmers' Pesticide Narrative, because this is a story by the participants that I talked with. And let me also give a quick background about Hmong farmers. Hmong farmers are pretty new to this country. We've been here for a little bit over 40 years ago from Laos and Thailand. Here in the Central Valley, Hmong, it's the second largest minority group here in the Central Valley. Hmong farms, about 900 farms classify as Hmong farms here in Fresno alone. So my work is working directly with the Hmong community, Hmong farmers community here in Fresno. Because of time, I'm just gonna give a quick review of the literature as we've been exposed to the significance of pesticide exposures in health. I like to just remind everyone that, according to the US EPA, majority of the pesticides that are being reported used in our community, it's in agriculture settings. And we also learned through years of research that the farming populations are more likely to be at risk of pesticide exposure, therefore adverse health implications. And what I found interesting, it's that majority of the available research had focused on large-scale farms, particularly white farmers. And there is a lack in terms of minority, smaller scale farms. And the Hmong farmers, it's a very limited study set of this literature. And what make large scale and small scale farms unique, it's that larger scale farms tend to be more established and have more resources compared to smaller scale farms. They have least resources, and they also tend to use more backpacking, spraying, or hands-on spread of pesticides. And because of the nature of how of these two modalities, we can anticipate that the risk of exposure varies depending on whether it's a large scale farms with lots of resources or a smaller scale farms with limited resources. So I look into the Hmong community or Hmong farmers community. I have a specific research interest. I just like to know more because there's no available research about this community. I like to just learn more about their daily farming practices and what are some of the challenges that they have, what influence their use of pesticides, and then the adverse impacts of using pesticide, whether or not there is an understanding between this process. And the reason it's because, as you're gonna learn through my study, that many of these farmers are being introduced to using pesticide for the first time in this country. And so I like to know, and most of the community, the farmers are also tend to be first generation farmers, lower literacy. So understanding this link is also important in terms of health implications. And so my study, it's informed by my second year study, which is a quantitative survey. And through that study, I realized that I need to do this next step, which is a qualitative mixed method study. Where I just need to talk to the farmers and really learn from them about their own pesticide narrative. And I also was informed through my second study that the best approach to work with this community is this snowball sampling method. It's a small, protected, close-knit community. And so to get to them, you really have to know the community. And to do that, I rely on my second year work where, and then also lots of community buildings, attending meetings, talking to family members who are farmers to connect me to their peers and colleagues, and then kind of go from there. And that's how I was able to work with the community, the Hmong farmers community for my study. The study was collected in the fall of 2019 to the early spring of 2020, and then because of the pandemic, I have to cut my study earlier than I anticipating. But it was great. It was a great time working with the community. I apologize. It's a little bit small, but I'll go over here. I'll go over the brief demographics. So majority of the participants in my study are much older in terms of age, and also in terms of language, right? 92% say their the language they spoken at home, it's Hmong, with 75% have no primary educations, and they're also much older in terms of age. The farm size also much smaller, about 7 acres. The average is about 7 acres. So when you're looking into the USDA definition, the small scale farms, Hmong farms are really, really small. And then with the average years of farming, it's about 16 years of farmings. And female, it's also the majority of my participants, about 62%. And I think one of the reason it's that it just, giving the nature of the Hmong cultures, I'm a female, so when I approach a farms or was referred to a farms, and when I say a Hmong farms, I mean, a Hmong farm is unique in the way that it's involved multiple individuals. So normally a Hmong farm have a there's a husband and a wife, and then their children who may be involved, either a son or a daughter, or multiple sons and daughter involving in this farm or operations. So it just culturally appropriate that when I talk to a farm, because I'm a female, then it's I approach the female first for consent, and then she would, and so I guess because of that natures of how it works, I just naturally have more female in my study than men. And a majority of the farms, they rent their plot. With the vast majority, they rent the plot. So that means they don't own the farms. And that also in translation mean that their lease may be up for the next few years. So they may have to find another plot and things like of that nature. I also, as I collect my data, I also have a short, survey, really just for demographic characteristics of like, do they have a, do they use pesticides on their farms, whether or not they have a pesticide permit or an applicator license, or what are some of the resources that are available to them in their language. And then I learned that, about 92% say they use pesticide. And I want to talk a little bit about the pesticide permit and then the pesticide applicator license. As a farmer, you need one or you either need a permit or an applicator license to purchase pesticide product. Otherwise,
Chia, a couple more minutes.
Oh, okay. You know what? I want to move on because I still have so much to talk about.
Sorry.
So I'm gonna move on.
We can continue in the discussion too.
Okay,
Hit your most important points. Thank you.
All right. So, as I start talking to the farmers, I really learned that when I asked them, tell me about your farming experience here in this country. And, all of them were like resort into a comparison between this country and their home country. So I kind of framed this as, farming experiences between the two worlds, because they kind of just naturally talk about their past experience and then their current experience. And I have a farmers who, and many of the farmers are resorting to the fact that they moved to the Central Valley because there is farming opportunity here, and it makes sense. When you come to a new country with no skills, and the farming is the best skills that you have, then you look for places where you can foster that skills. And so, for example, one of the farmers said, I farmed back in Laos, and after moving to the United States, I want to farm, so I moved to the Central Valley. And then again, one of the comparison is that, in their home country, they don't use, everything is just based on hands and it just performs by hand. Whereas in this country, they have a farm equipment and then pesticides as resources, which is these are the type of resource that they don't have back in their home country. And again, this is back in their time. I know now it's a different time and back in their home country, but this is the kind of experience that they share with me. It's just the two different type of very different practices. And then the other that would also come, the other message that it's this economic sense. Back in Laos, they farmed to feed their family, but in this country, it's different, right? It's a little bit for economic incentive. And then, but also it's they, because of that, then that also required them using the available resources they have to make sure that they could maintain their crops. And so, for example, one of the farmers said, in this country, if there's no pesticide, we cannot produce here, for example. And then I'm going to move on to my last message, which is, whether or not they understand the implications of using pesticides. And, majority of the participants say yes. I think that if these chemicals are capable of destroying a pest, then it can do the same thing to people too. And so these are some of the messages that I have, kind of concluding my main part of this study. It's that because they're in a time where they are no longer in a space where they knew or familiar with, so they're now adapting to different resources that they have. And doing so, there are some opportunity and challenges for the farmers. And one of them is again navigating this space in a time where many of our parents, or most of the farmers, tend to be much older with literacy as issues, and therefore there are other implications come with that. But in general, yes, is my time up? Okay, so I just want to thanks special thanks to the Hmong farmers. I was able to do my work because I was of the Central Valley Graduate Fellowships, and then also my committees and some other individual in the community who have helped me with my work. Okay, thank you.
Well, thank you so much, Chia. It's lots of questions I'm sure will come up, but really important and novel research. Our next presenter is Nimrat Sandhu. Nimrat is a PhD candidate at UC Merced and is going to be presenting her paper on research on the impact of the Affordable Care Act on farm worker access to and utilization of healthcare services, and evidence from the NAWS study. Nimrat, thank you.
Thank you, Ellen. So can you all see my screen?
Yes.
Okay, hello everyone. My name is Nimrat Sandhu, and I'm a PhD in public health student at UC Merced. So today I will be talking about the impact of the Affordable Care Act on agriculture worker access to and utilization of healthcare services. So I will be using evidence from the NAWS, which is the National Agriculture Worker Survey. So first, I'll provide a brief introduction of the issue. As you are all aware, agriculture workers have long been known to lack access to health insurance coverage, and the situation is even worse for undocumented agriculture workers. The Affordable Care Act was passed in 2010 with the objective of improving health insurance coverage for citizens of the United States and individuals who have legal status in the United States. So next, I'll talk about the impact of the ACA on agriculture workers. So under the ACA, legally present H-2A workers can seek health insurance coverage. Undocumented workers are not eligible for coverage. Small farmers with fewer than 50 employees do not need to provide health insurance coverage. Employers are also not required to provide health insurance coverage for workers who work for less than 120 days, so the seasonal workers, and migrant workers can only purchase insurance in the area where they have established a permanent residence. So the purpose of this study was to examine the impact of the Affordable Care Act on documented and undocumented workers in California in comparison to the rest of the US. So we compared health insurance coverage and healthcare utilization using data from the NAWS for the years 2011 and 2016. So next, I'll briefly talk about the methods. So we used data from the National Agriculture Worker Survey. So we selected 2011 because it was close to when the Affordable Care Act was passed. And 2016 is the last publicly available data set from the NAWS. So for health insurance, we focused on the question, does the farm worker have health insurance? And for healthcare utilization, we focused on, in the last 2 years, have you used any type of healthcare services from doctors, nurses, dentists, clinics, or hospitals in the US? Logistic regression analysis was performed to study factors affecting health insurance coverage and healthcare utilization. But today, for the sake of simplicity, I'll be mainly reporting percentages. So first, I'll talk about the impact of the ACE on health insurance coverage. So if we look at the US as a whole, in comparison to 2011, health insurance coverage rose from 30.5% to 48.5% in 2016. So as you can see, there was an increase. So next, I'll be talking about the impact on California. So in California, coverage increased from 31.6% to 58.6%, while for the rest of the US, coverage changed from 29.8% to 40.5%. So as you can see, coverage increased from California more than the rest of the US. So next, I'll be talking about the impact on documented versus undocumented workers in California versus the rest of the US. So if you look at documented workers in California, the health insurance coverage increased from 48.4% in 2011 to 82.3%. And if you look at undocumented workers, from 19.4% in 2011 to 42.2%. But in the rest of the US, the change was not as significant, with the coverage increasing from 47.1% among documented workers to 62.8%, while for the undocumented workers, the change was only from 7.4% in 2011 to 11.7% in 2016. So next, I will briefly talk about the impact of ACE on healthcare utilization. So if we look at the US as a whole, coverage healthcare utilization increased from 61.6% in 2011 to 64% in 2016. Now, when we look at California, the impact was slightly greater than the rest of the US. So healthcare utilization among documented workers increased from 64.6% to 73.7%. Among the undocumented workers, the change was not as significant, changing from 52.2% to 55.7%. When we look at the rest of the US, among documented workers, healthcare utilization actually declined slightly from 76.3% in 2011 to 71.7% in 2016. And among undocumented workers, there was some increase from 48.5% to 57%. So next, I'll be talking about different forms of payment being used to pay for healthcare services among documented workers. So among documented workers, payment from out of pocket in California declined from 36.7% in 2011 to 15.8% in 2016. And the use of Medicare or Medicaid as a form of payment actually increased from 17.1% to 35.2%. But when we look at the rest of the US, the impact was not as dramatic. So out-of-pocket payment for healthcare services among agriculture workers declined from 39.8% to 21.5%, and the use of Medicare or Medicaid as a form of payment increased from 10.5% to 17.8%. So now let's look at undocumented workers. So when we look at undocumented workers in California, so out-of-pocket payment declined from 61.8% in 2011 to 42.1%. Medicare or Medicaid as a form of payment increased from 6.2% to 10.9%, and employer-provided health plan actually increased from 9.4% to 23.1%. So there were some significant changes, but these changes were not as significant in the rest of the US. So out-of-pocket payment for agriculture workers in the rest of the US, they changed from 67.7% to 60%. Medicare or Medicaid as a form of payment changed from 2.6% to 4.1%, while employer-provided health plans actually declined from 6.2% to 4.4% in 2016. So next, I'll briefly talk about these results. As you saw in the previous slides, the introduction of the Affordable Care Act was associated with a significant increase in health insurance coverage among agriculture workers. there was no real increase in healthcare utilization among agriculture workers. And as you all saw in the previous slides, these changes were much more significant for California than the rest of the US. A large percentage of undocumented workers did not have health insurance coverage, but coverage was much better for undocumented workers in California in comparison to the rest of the US. So there could be several potential reasons behind the results. So one potential reason is that California adopted Medicaid expansion early. So California adopted Medicaid expansion in October 2013, and the coverage became effective in January 2014. The second potential reason is that California did a better job at implementing the ACA. So the uninsured rate in California dropped faster than the rest of the country. Another potential reason is that California has enacted other policies which were effective in improving health insurance coverage to agriculture workers. Another reason is that growers in California have done things differently to improve health insurance coverage for agriculture workers. And finally, the fifth potential reason is that community groups and worker advocacy groups have been much more successful in trying to obtain health insurance coverage for agriculture workers. So next, I'll talk about policy implications. So
Nimrat,
this study,
a couple minutes.
okay.
Thank you.
So this study has some important study implications. Firstly, other states should consider improving their policies for providing health insurance coverage. So as you saw, California had much better rates in comparison to the rest of the US. But further work is needed to identify the exact reasons behind the differences in rates of coverage, particularly among undocumented workers in California. And health insurance coverage overall needs to be improved for undocumented workers all over the US, but further work is actually needed to determine if the differences in rates of coverage for undocumented workers in California were actually associated with better health outcomes. And finally, states should consider funding an agriculture worker-specific Medicare type program, which would provide health insurance coverage to all agriculture workers, regardless of legal status. Thank you for your time, and I'm open to any questions that you may have.
Terrific. Fantastic research. And we'll get to more questions after our final presentation. Anuvir Singh is a MD, MPH student at UC Berkeley. His presentation will be on COVID-19 education and resource development for Punjabi-speaking farm workers in California. Anuvir.
Hello, everyone. Thank you for having me here today. My name is Anuvir. I go by Anu, like a new person, if that helps you remember my name or say it easily. My project is on COVID-19 education and resource development for Punjabi-speaking farm workers in California. I wanted to start this presentation by telling you all a bit about myself. So I am a medical student at UCSF. I'm currently on a gap year. I'm pursuing an MPH at UC Berkeley. And as part of my MPH program at Berkeley, I am required to do a capstone project. So I worked on a capstone project in collaboration with the Ag Center at UC Davis and my advisors at Berkeley. So I'll be doing some of my work from my capstone project from the MPH program at Berkeley. Some of my clinical and research interests include social emergency medicine. So I am applying into emergency medicine residency this upcoming fall and hope to pursue a career in social emergency medicine, a new developing field that collaborates kind of social determinants of health into emergency care. My other interests include rural and farm worker health, hence this project, and mentoring first-gen students to college, and lastly, public health and public policy. That being said, so in this presentation, I will be going over some of the background, public health significance, research objectives for my project, methods, some preliminary results, next steps and questions. I wanted to take this moment to acknowledge the topic inspiration for my project, which comes from my father, who is a farm worker. He is depicted in these pictures in blue, and along with his other co-workers. this was taken during last harvest season last year. So yeah, I just wanted to thank my father and all the other farm workers who help feed us on a daily basis. A bit of background on my project. So according to the 2013-2014 National Agricultural Workers Survey data, majority of agricultural workers are foreign-born. This consists of about 73%. Of that 73%, 68% were born in Mexico, 4% in Central American countries, and 1% in other countries, including Asian countries like India. So currently, there are no COVID-19 specific resources for Punjabi-speaking farm workers. The Western Center for Agriculture, Health and Safety at UC Davis, they have developed some resources for English and Spanish-speaking farm workers, and they have extensive knowledge and experience in creating these resources. So I collaborated with them to extend their work to another underserved group, which is the Punjabi-speaking farm workers, specifically in California. So a public health significance for my project, it definitely has a huge public health significance given, it intersects the pandemic along with all the barriers that farm workers face on regular basis. So in terms of equity, we hope that our project will address health inequities through providing culturally competent and farm industry specific COVID-19 educational resources. It is our hope that with the help of these resources, we will be able to improve the understanding regarding COVID and safety practices to prevent COVID transmission, both at workplace and in the community in general, which will hopefully lead to lower COVID-19 transmission rates among Punjabi-speaking farm workers and just the general public in general. So a research goal is to provide culturally competent, linguistically appropriate, and agricultural industry-specific COVID-19 resources to Punjabi-speaking farm workers in California. Here are the 4 main objectives for our research, for my research study. The first one is to really understand the COVID-19 educational needs of Punjabi-speaking farm workers in California. I haven't found any studies or research that have actually elicited this information. So the first step is to just learn about the community and learn what their needs are. And then we will do this through assessing current COVID-19 educational resources for their cultural competence and language access and their cultural relevance for these farm workers. And lastly, after getting this information, we hope to develop new COVID-19 educational resources for Punjabi-speaking farm workers. And the final research objective is to disseminate these new resources in collaboration with community organizations, the Ag Center at Davis, UC Davis, and other agriculture industry representatives. So in terms of research methods, this is a 2-phase qualitative study. In phase 1, we are currently in phase 1 of the study. We are currently conducting key informant interviews using the semi-structured interview guide, which I'll show in the subsequent slide. We are asking participants open-ended questions to assess the current COVID-19 educational resources that have been developed by the Ag Center at UC Davis, to see how basically elicit their opinion on what they like and what they dislike about those resources, and what sort of things they would like us to have in the resources that that they can connect with. So following the key informant interviews, we will create some new resources for this community. And then in phase 2 of the study, we will conduct focus group interviews with 5 participants in each group. And the goal of these focus group discussions is to assess the newly developed educational resources that we will create after phase 1, and eventually modify them based on the participant feedback, and disseminate them through community organizations and agriculture industry representatives. So here's the interview guide. I know it's pretty text heavy. We don't have to focus on everything, but this is the interview guide that we are using to conduct some of the key informant interviews. So some of the themes that we are focusing on are what are the key themes for farm workers, basically in regards to how do they typically educate themselves, what sort of information are they interested in, what kind of reference materials would they find helpful. And then another component is the key themes regarding platforms. How do they access this information? What sort of like platforms does this community use to engage with educational resources? And the last two are key themes regarding print materials. So if they prefer print materials, we wanted to know what sort of the size of print materials they prefer in terms of images. Do they prefer photographs versus illustrations? And then the amount of text, do they want 50% text, 75% text, all text? And then in terms of colors, do they want any specific colors, or any colors is fine? Or do they want these resources to be black and white? And then lastly, we are eliciting themes regarding radio and video examples. A lot of Punjabi-speaking farm workers, including my father, have used radio for these information, and we'll be eliciting themes regarding that.
Can you wrap up minutes?
Yeah. So these are the resources that we use for the key informant interviews. So I showed them these resources and elicited participants' input. These resources are pretty specific to the agriculture industry. So based on the preliminary results, we did find that COVID-19 knowledge is for farm workers is mainly obtained through TV, physicians, and family members, and none said through employers. There was unanimous interest in receiving COVID-19 education and safety information. Handouts and posters and videos were preferred over other means. And lastly, a couple of the results, key themes regarding platforms. People preferred printed materials. In terms of preference, they preferred a typical 8.5-inch by 11-inch handout size with culture relevant photographs, or for instance, like individuals wearing a turban and a mask with a turban. They prefer limited text, mostly a set 50% text, 50% pictures, and then use of color, but no specific preferences for what color they wanted. And then key things regarding video and radio examples. People preferred both of these resources. For video preferences, they also preferred live action videos instead of like cartoon illustrations. And then they wanted the videos to be short, typically 1 to 2 minutes. And again, characters that represent the Punjabi community that they can engage with. So yeah, lastly, I wanted to end with the next step. So we will complete the key informant interviews in the next week or so, and then create these resources, and then move on to phase 2 of the study and eventually disseminate, hopefully by early summer this year. There's a bit of timeline, we don't have to go through this, but I just had to go through a lot of IRB gymnastics to get this approved given COVID pandemic. And I also have collaborators and undergraduate researchers at UC Davis who wanted to be part of this project. So there was a lot of back and forth with IRB, and that kind of delayed the project somewhat, but we're on the right path now.
Okay, thank you. Thank you, Anu.
And I wanted to acknowledge the Egg Center, UC Berkeley School of Public Health, my advisor, Karen Soko-Gutierrez, the Egg Center, Dr. Pinkerton, and Heather Ryden. They have been really instrumental in helping me. And lastly, the undergraduate researchers who are currently still undergoing the IRB process, but I hope to have them on board soon.
Thank you, Anu. I wanna try to get to as many of the questions as we can. A few for Taylor. Thanking you very much for your important work. I'm wondering if you collect any information how the traveling impacts the children's mental health and education, or gender-based violence affects girl farm workers.
Yeah, so thanks for that question. We did collect information on this. And so there's 2 issues here, migration and gender-based violence. So for migration, Yes, it absolutely disrupts education, because a lot of the times the kids will start school actually in North Carolina in the fall, and then they'll finish up sort of the harvest season here and go to wherever they're going, either Florida or Texas. They'll start school there. And of course, there's lots of disruptions because they don't know. I mean, the school systems are completely different, but also disrupts social relationships. So, and then also rural school districts tend to not have great accommodations for ESL students. So those are a few things. As far as gender-based violence, there were a few cases of the girls reporting sort of hostile work environment. But again, sort of methodologically, I don't think we could get sort of the depth there. So that's a brief response.
Thank you. And for Chia, is there any data on the health of the small scale Hmong farmers, in particular, any diseases that might be related to their pesticide use and exposure? And I was also wondering where the Hmong farmers are getting their information about the hazards of pesticides and alternatives.
Yeah, I have another chapter that it's that focusing on that. But for the first part of your question, are there any are there any data showing the risk of Hmong farmers using pesticides and health implications? Not that I am familiar with. I had been digging research to see if there's any baseline that I could build on, and I have not found any anything specifically to the Hmong farmers and their and risk of any of the chronic health conditions. And then then the second part of your question, it's where do they where do they maintain or access health informations? So I have another chapter that I had looked specifically into that, because that is part of my research interest. It's kind of similarly to other findings, it's just peer-to-peer educations. There are two specific sources here where they consulting for, like, the more for agriculture related, but as far as health implications and I don't think there is any resources that it's available to them. I have one of my questions asked are what are some of the resources that are available to them in their language, and which language do they prefer, right? Most of them are not aware of any health specific resource about use of pesticides and risk of poor health implications. However, they kind of just gather these informations through words of mouth of other incidents of particular acute incidents of that happened, and so it's a small community, so things kind of travel among that, and so that's how the flow of information.
Okay, great. Bonnie Bate, whose presentation was terrific earlier today, comments, thanks for the interesting and relevant research, panelists. I appreciated learning about farm worker communities we don't usually get the chance to know, such as children workers, Hmong farmers, and Punjabi-speaking farm workers. I read that because it echoes exactly what I wanted to say, in addition to my praise for these fantastic next generation researchers. She has a specific question for Anu. Do Punjabi farm workers work at Punjab owned farms, or are they working for farm labor contractors along with Latinx and indigenous farm workers? I ask because the influencing factors such as transportation, employer protections, immigration status may create unique COVID-19 related work experience. So a quick answer from Anu. Thank you.
Asking that question, yeah, definitely. I think from my personal experience and from like what I've seen in the community, most Punjabi-speaking farm workers do work on farms that are owned by Punjabi small farmers. However, there are some individuals who work at workplaces where either the supervisor is Punjabi or there is a large workforce of Punjabi-speaking farm workers. My dad used to work at one of those farms called Maddox Farms, but he currently works for a Punjabi-speaking farm worker. Yes, in terms of your influencing factors, transportation, for instance, and employer protections and immigration status are, they have somewhat unique challenges for both like Latinx farm workers and Punjabi-speaking farm workers. Speaking from the perspective of Punjabi-speaking farm workers, employer protections are not always followed by small farmers, and they are mostly working either cash jobs, so they are not getting overtime or other benefits and sick leaves and other issues of that sort. And immigration status, most of the workers that I have interacted with do have documentation status and are eligible to work in the US, though most prefer to work either for cash for these workers. Yeah.
Thank you. And a final question for Nimrat from Dr. Sandoval. Could you address CMPS that is available for non-Medi-Cal people, including undocumented? I understand 31 counties in California have it, with YOLO being the last to join. So a quick response from Nimrat, please.
So there has been some improvement. So California has done in general a much better job of improving health insurance coverage for undocumented workers, and CMPS has been very important in that. So I've not currently looked at data from CMPS, the absolutely current data. So the NAWS data set is relatively older. But the research that I did kind of does look at the fact that there has been an improved coverage, and CMPS could be a potential reason behind that.
Thank you. And there was also a question for Taylor. Whoa. I can't find it now. Okay. Oh yeah, how much of the child labor is seasonal? I'm not sure who that was directed to. From Taylor's, I guess Taylor's presentation is the only evidence on child labor.
Yeah, so I mean, seasonal, we're really a lot of both migrant and seasonal farm work occurs during the agricultural season. So it's really, we're talking about the classification of whether or not they live in North Carolina and just work during the summers, or if they, migrate and work during the summers, and sometimes it bleeds into the fall or the spring. So I would say it's, a lot of it is seasonal. There's not that much work during the winters.
Well, I think our time is sadly up. I want to thank all of the panelists for terrific presentations and really important, relevant research that I hope will guide public policy, further research, medical care, legal protections, all of which are really indicated based on all of this research. I feel a great deal more confident with this next generation of exciting and supremely competent researchers, and look forward to seeing their work in the future. So I think that ends our panel, and I guess we need to return to the webinar 1 for the final panel and the concluding comments by Assemblyman Rivas. Thanks so much, all of you.